Banga. I'm a director at Bungoma Children's Hospital. So today, in solidarity with Rufa regarding SHA, we've decided to suspend services to members who are benefiting from SHA because of non-payment. As a hospital, we've made claims of up to 10 million, but we've not received payments that can enable us to sustainably continue providing services. And the payments from SHA are made in such a way that you don't know when to expect. So sometimes it's difficult in terms of planning purposes. Remember, hospital is run with supplies. We have rent to pay, we have workers to pay. So when you don't know when to get this money, sometimes it becomes a bit difficult to run the affairs of the hospital. And remember, the insurance works. Insurance works in the fact that hospitals offer services first, then they're paid later. But you find there are some claims that you raised as early as at the start of the year, and yet they have not been paid. And this is September. So you see, patients think that already since they have been deducted from their cover, then they presume that the facility has been paid. But in reality, the facility has not been paid by SHA. So it becomes a bit difficult. Initially, SHA said that they'll be settling all bills by 14th of every month, but this has not been happening. So most of the time by 14th, like this month, no allocation has been paid. I think the last time we were paid has been more than 2 months ago, and it was just a fraction of whatever we are meant to be paid. And so if, because the ministry has really solved SHA, and SHA is a game changer. But now, when hospitals are not being paid, then it becomes difficult to fulfill the vision of UHC, that's universal healthcare, because now one factor that is key, which is finance. Finance is a key factor in UHC. And so, because there are around 6 pillars that hospitals thrive on. So if the finances are not adequate enough, then it is impossible to offer quality services. And sometimes people will tend to do shortcuts because of the costs and because they're not been enabled. But you see, when SHA pays for the services, then the hospital is able to do budgeting. The hospital is able to recruit personnel knowing that is able to pay based on the ability to pay and retain these healthcare workers. Remember, healthcare workers, sometimes they can be a bit expensive, so retaining them is costly. And so when they feel that they are not being paid, they might refuse to offer services to the facility. And remember, the patients will not understand. The patients will come in and they'll tell you that I have an insurance cover, so I'm supposed to get help. I'm supposed to be treated in any facility of choice. But you see now, sometimes market forces come into play now, because now you've not been paid. So you wonder, should you close the hospital? Should you continue seeing, because every time you continue seeing the clients, then it means that you are utilizing medicines, you're utilizing supplies. You need supplies. Those who are admitted, they require food. They require their beddings to be washed. They require basically everything. So because hospitals are it's like a hotel plus curative services. Because now when they come in, they also expect to have their lives just like they're staying at home. And so this requires money. So when hostels are not paid for such long periods, then it becomes unsustainable for them to provide quality services to the citizens. But all in all, we are, as a hostel, we are supporting the president. We are supporting the president keenly, so that to ensure that no one is left behind in terms of access to quality and affordable healthcare. But it's our prayers that those who are the ones responsible for paying hospitals, let them pay hospitals, so that we don't have to strike, or we don't have to offer strike notice for us to be paid. Let hospitals be paid because they have offered services. So what is preventing them from being paid? And we had issues last month whereby most of the bills that were sent to SHA actually they are brought to facilities, and some facilities lost even as high as 5 million. Some lost 2 million because these are bills that had been approved earlier. Then they came back as rejected. So understand that SHA has also given a 2 weeks period for facilities to re-upload where there was issues. But for example, an issue like a patient staying something like overstay in a hospital. You see, some of the bills are not paid because of overstay. So you're asking yourselves, who determines overstay? Is it the patient's condition, or is it SHA? Or because according to SHA, if a patient stayed more than 5 days, then they can't pay. They count that as overstay. But a patient has come in, maybe he had meningitis, so he has to be treated for more than 10 days. So as it is, SHA refused to pay all those bills, saying this is overstay. So you want to be told, what is this overstay? Because now, if somebody has a condition that requires them to stay for even 10 days in a hospital, then it becomes difficult for us. And remember, this patient is being treated for meningitis. And you are saying this is short stay, or this is long stay, so the bill is not being paid. Because then, or even asking yourself, then why can't you pay for those 5 days that the patient stayed, and then leave these other ones which are in contention, so that can be solved later on. But eliminating the entire bill, yet this patient came to a hospital, he was treated, he was given food, and then you eliminate the entire bill. How do you want to? Basically, it's like you are killing this hospital. Because you see, they have provided service, but now when it comes to reimbursements, it becomes an issue. So if there's a way that this could be addressed, I think this will really assist facilities in ensuring that they have liquidity, so that in terms of supplies, medicines, they are available. Remember, in private facilities, most patients come there because of availability of drugs. So you see, but when you are put in a level whereby you can't even stock, you start having issues even stocking basic medications, then it becomes difficult for us to achieve UHC. Because UHC requires that you need to get, the service should be available across, and it should be affordable. And it should be access, that's access, like everybody should get access. Because if this happens, then most of our population, basically, they'll end up getting quality healthcare. Now, currently, we've not made any admissions. Because now we are not yet, we are waiting for more feedback from ROFA, and so that we can deliberate on when to